Welcome back to Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, we're just crazy passionate about healthcare innovation and adoption. And our aim is to bring real stories of real people that are innovating within healthcare. You know, at the end of the day, we've just got a really action-packed year. And if you haven't checked out any of our previous interviews, go back, check them out. You'll love them. I'm just delighted today to introduce to you Anirudh Satya, who is the co-founder and CEO of Teamwork Healthcare. Welcome to the show.
Hey, thanks for having me on. Appreciate it.
So, do you mind if maybe we just kind of take a step back, Rudy, if we can kind of dive in a little bit of your background, which is really unique, coming from kind of the investment to now coming into something that's a little bit more, I'll just call it passion oriented. So share a little bit of your story with the audience and we can kind of dive in deeper.
Yeah, so I started off as a finance bro. So I began in investment banking. I did M&A. I doubled down a bit and I moved over to private equity. And so I thought I was doing something helpful by essentially buying businesses, building them, and kind of sending them off. And I didn't find that's what I really did. I actually spent far more time making unachievable budgets, and then when you don't, when reality doesn't hit expectations, you just fire people. And so I got to see that firsthand. I got to, clash with my own teams and be like, this doesn't feel right. And so ultimately it felt like I wasn't quite happy with where I was. And so I volunteer a ton. I volunteer at nursing homes, rehab clinics. Right now, I pretty much volunteer most of my time at a soup kitchen, but I've also spent time volunteering at Brooklyn Autism Center and Autism Speaks. And so through that, I really learned about families that had been dealing with raising their children with special needs, specifically autism, and knew that there was a lot more support that they needed. And if I could dedicate my time and energy towards serving a more vulnerable population, it would give me joy. And so I ultimately made the decision to leave and start Teamwork Healthcare, which I can speak to.
Yeah, let's talk a little bit about Teamwork Healthcare. And just, I remember when we first initially met and you kind of shared your story, it struck a chord with me personally, just having a kiddo that is on the spectrum, that has a unique set of needs, and seeing the world from their eyes. So when I started to learn more about what you guys are doing and how you're serving families in need, I just felt like, yeah, this is someone that I want to get to know more. So talk a little bit about Teamwork Health and how you guys are serving this population, which oftentimes is quite underserved.
Yeah. So, at the very basic, we provide community-based applied behavior analysis services. And, in layman's terms, what that means is we have our ABA professionals or therapists go to the family's home, school, daycare, and provide support where they need it, rather than like clinic-based where families come to us. We go to where they need it. And then our behavior therapists, they can very simply, if I'm like boiling it down as simple as possible, can help either increase pro-social behaviors or decrease maladaptive behaviors. You can think like helping someone with toiletry skills, dressing, bathing, activities of daily living, going from nonverbal to verbal, peer play, or reducing certain behaviors like tantrums and such, self-injurious behaviors, aggression. Now that's the basic, but not every company does things the same way, and not everything works necessarily in the best interest of families. And so I think there's really three things, having talked with families, that we felt, I felt should be the foundation of what we were building at Teamwork, which was it has to be affordable. It's already expensive to have kids. And then if you have a kid with special needs, it's exponentially that more so. I mean, you might typically speaking, a family that needs ABA probably needs speech language pathology, probably needs a special ed attorney, probably needs OT, SLP, PT, maybe counseling. It's so
Developmental therapy.
expensive.
Yeah.
Yeah. And like, it's so incredibly difficult to get that much support. And with mental health as a whole, very few people accept insurance. And so, on average, the family needs 15 to 20 hours of ABA per week. And if you just, multiply that by, 50 hours per week or 50 weeks per year, you're talking about 50, 60 grand on average that most people can't afford. And so I wanted to be able to be in network with pretty much every insurance plan, including managed Medicaid plans. And so it ends up being $20 a day versus that much, or even zero if you have a managed Medicaid plan and they're just funded by insurance. So I wanted it to be affordable. That was one thing, because I didn't want to just serve the rich Upper West Side folks of New York. I wanted to be for everyone. And then two, there had to be really high quality services. And so you can have providers that they'll say they have 10 years of experience, but 10 years of experience as a paraprofessional might mean 0 years of ABA experience. And even if you do have 10 years of ABA experience, if you're only used to working with adolescents that are preparing for college, very different from a 2-year-old that's nonverbal, or someone that has a lot of aggressive tendencies and you're not comfortable working with those. So we wanted to get actually experienced folks. And then the third part was technology, which was, how can we either leverage every third-party tool available to automate or make life simpler, not just from our side with reducing admin, but can you automate invoices, make everything electronic? Can you abstract all of the insurance stuff for families so that we can do it for them? They're not dealing with prior authorizations. They're not dealing with submitting claims. They're not dealing with any of it. We just handle it for them. So that was the kind of mission, is if we can do that, we'll really help folks. I think it's not just putting, I get a great amount of joy being I've created jobs rather than firing, which was my previous life. But it's also families will tell us that we are more helpful for their kid than school, or my kid now looks at me, or my kid now speaks. It's life-changing. And so, I'm pretty happy with what our team's done thus far.
It seems like your moral compass is driven towards helping, and what you've described is providing a greater level of access in this particular niche. Do you find that seeing a lot of these problems came from spending a lot of time in volunteering and interviewing? Talk about that process and what made you sort of land on this particular area, and then furthermore, talk about your team, your business partners, and then maybe we can talk about how you guys have been kind of evolving and innovating throughout the last year, since things have been a little different.
Yeah. So I kind of just having specialized, I was a generalist M&A when I was in banking, so I didn't really know what I wanted to do if I were to quote unquote solve a problem. Then I was lucky that I asked to be in healthcare when I was in private equity, and they siloed me there. I think it was being a hippie vegan. I was oh, I don't want to buy companies that rely on killing animals or whatever. So consumer restaurants, that's out. Mining minerals doesn't seem sustainable. Healthcare, you just help folks. It just was I'll be in healthcare, feel good. So I specialize in healthcare with a sort of broad reason. But once you get into healthcare, you learn about several different industries, and kind of knew mental health was just, there was just so much room for improvement. And so I knew from my private equity days that mental health was a sector that just needed a lot of, support and change, and it was growing, and it just, there was opportunity to actually, create something better. And then, from there, it was really volunteering that made me decide ABA is what I wanted to spend time on. Pretty much the only way to really know if you care is by doing it. And so when I would go to different clinics or like rehab centers or eating disorder centers, I just spent time there and I tried to help folks. And I was like, just walk in there and be like, what can I do? Frankly speaking, like rehab clinics were kind of dreary for me. I mean, they absolutely are a necessary form of support for folks, but I just didn't connect as much as when I went to Brooklyn Autism Center and I'm speaking with the founder there, and her son walks up to me like, he's a small guy, so like when he hugs you, like he hugs your knee, and like a little kid hugging your knee, like patting you on the head, and we're just talking, and I just got along quite well with him. I was like, this is this is what feels right, and then so that kind of like pulled on the heartstrings, kind of made me be like this direction. And then when you talk to the families, learn about the financial consequences, you talk to providers and learn about all of their headaches, you're like, okay, I can try to address those, but I also know I'll care. And that's kind of what made me zero in on ABA, because I was like, this is where I feel strongest about, and I'm like, I want to help you.
So now that you guys are driving and delivering care directly at the home, which is again, it's convenient for family members. Talk a little bit about, I mean, the last couple of years have been a bit bizarre. Can you maybe share how you as a business kind of navigated through those uncertain times, and maybe ways in which you've kind of have evolved the business, have innovated through that, maybe even sharing some little wins and maybe even some learnings?
Yeah, so I was we got up and running August of 2019, so maybe we had 6 months of pre-pandemic ramp up time. And I can also talk about my co-founder story there, because I cold called her, so that's, I think, more unusual compared to the average story. And so, but in terms of us trying to innovate there, we were bootstrapped, and so we just grew through word of mouth, and we were growing decently well. And then pandemic happened, and then everyone was like, oh, I don't know if I want people to come into my homes. It just became a lot more difficult. And we actually switched to telehealth, and that was a joke. If it honestly was, like, if you have 3-year-old like clients and the mom and dad aren't there, what if the 3-year-old crawls away from the screen? What do you do?
Yeah, I can just tell you from firsthand experience, having like I said, having a kiddo on the spectrum, and that just is not it's not helpful. Again, every kiddo that's on the spectrum is different. By the way, if there are any parents that are on here that are listening, a great book that really shaped my thinking is a book by Dr. Barry Prisant called Uniquely Human. I don't know if you've ever got a chance to read it, Rudy, but it definitely impacted me profoundly.
I'll order it and I'll be done with it within 3 months. You said Uniquely Human, right?
Yeah. I'll send to you after this.
So we tried telehealth. It didn't work terribly great for most families. There were certain families where they could benefit from it, but largely speaking, direct services didn't. But what it did work really well with was, we previously had the supervisor, like we have a doctor-nurse model sort of, where we kind of have someone develop the treatment plans and then someone executes on it. And previously, supervision was always in person. And now, because we decided to give every family an iPad, you could just have the supervisor Zoom call in. And so you could have remote supervision, which made it far more easier for us to staff if they had the appropriate experience, because geography became a little bit less of a constraint, given we provide community-based services. And so that became a little better through that. We also, families were struggling with timing for parent training, because you need the families to also learn ABA, because when we're not there, they still need to, execute on what we feel is helpful. And so, parent training became way more easier because we could do it virtually.
Yeah.
And so that was something that was quite helpful. So I think, the pandemic did force us to pivot a little bit. At the end of the day, we didn't fundamentally change to a telehealth company, but pandemic didn't kill us. And then we were able to grow really well out of that and kind of tweak things. And then really started growing a lot more once we were willing to accept new clients. Because I think the first 4 months of the pandemic, we're like, we're not going to take on additional families while we're still figuring out how do we properly handle telehealth or COVID. Then when we felt comfortable and opened our waitlist out again, we really accelerated.
Look, this group of this community is a very tight knit community, and people talk to each other. Outside of the word of mouth, what really kind of catapulted you guys into that next level of scaling? Was it solely word of mouth, or what else did you guys do to really kind of propel you into that next stratosphere?
It was, I would say our referral sources were one or two neuropsychologists that when they diagnosed, they were like, consider teamwork. And then it really was word of mouth. And it wasn't just word of mouth it was word of mouth, not just from other family members, but also our therapists that were working for like multiple different companies. They would just start they're like, we just want to bring them over to teamwork. And I was like, initially I was like, why? Like, if you're not really changing, like, I still think at the end of the day, I'm not important. It's like the quality of the therapist that really moves the needle. So I'm like, why? And they're like, well, the families are paying out a network there, plus the people don't give me any support or supervision or training. And at Teamwork, like, I have all these clinical directors that if I ask for training on this subject or that subject, like, they're on top of it. Like the next week they do a company-wide training on it. And it's more affordable to be with us. And so I think we had a lot of our own therapists bring over families too. So there's a lot of a virtuous cycle that I'm just grateful for, because, maybe I should have been a better marketer, but wasn't my expertise. But I think in the last 10 days, we've started, Facebook ads and Google ads, and, completely new to that field.
Yeah.
But we are very fortunate that it was through word of mouth, which I think is, speaks to the strength of all the clinicians that my co-founder Erica has, trained and brought under the, helm.
Yeah, and in your business, it being so human centric, the product is the human delivering the service. Can you talk a little bit about the technology? Because obviously you guys, as being a tech-enabled services company, talk a little bit about that aspect, if you don't mind.
Yeah. So I think what we've done in this space that no one else has done is we created the first managed marketplace. And so what that really means, or I'll take a little step back, is families like yourself or anyone that wants to get ABA services, they have to call 15 different ABA companies and be like, can I join your waitlist? Can I join your waitlist? Do you accept insurance? Blah, blah, like, and then you just join their waitlist. You have no idea what's going to happen. Like, I don't know if they're actually staffing someone. I don't know why they're staffing someone, which way or what. You're just in a black box, essentially. What we do is, and then that's from the family side, where they have no visibility after they just make that phone call. And then from the, what the typical ABA company is going to do is they're going to take that simple intake form, they're going to just email blast all the therapists and be like, who wants it? And then it's a point in time thing. So if no one responds, then who knows if a week later, like, new therapists join or new therapists leave, are you following up and seeing if the family is getting staffed? Very inefficient. It's a point in time kind of who wants it. the second issue of that, with it being point in time, is it's also like whoever raises their hand first gets the case. And that's stupid. Like, you're not getting the most appropriate team members. When we talked about, we created a match score for between every single therapist and every single family, based on like aggression, verbal behavior level, age, multiple different factors that help, and we weighted things to come up with a match score. And only if you fit like that, then you can see a potential case. Then you can, filter based on geography, because someone from, one part of town might not be willing to go to the other. Same thing with availability. Like, you might be willing to work with a client, but if they want services from 9 to 11 and you're only free 3 to 5, doesn't work. So that kind of puzzle piece, matching things together gets to be a nightmare quite quickly. And so we created the first managed marketplace where, we can align based on actual need versus whoever raises your hand up. And then the point in time issue is, it's a simple thing to solve maybe, but it's a huge issue because therapists, let's say they don't check their email for a week, because therapists are terrible at, reading emails and communication to like tech or finance people. Like, they might see the email from like 6 days ago or 8 days ago, like a client was available, and they'll just think it's staffed, even if it isn't. And so they'll just not respond to it anymore. And that just sucks for the family. Like, you need early intervention, like kids are just falling behind. And if you're like, oh my God, it's only because they made some random assumption that my kid is not getting the support he needs, or she needs. And so, we kind of developed something that, is constantly giving families updates like, this therapist is looking, this therapist agreed, your team is complete, or no one has, 7 people are interested, but no one responded. So it actually makes someone feel a lot better about being on a, wait list versus just being like,
I want to say something here. So, because what you're talking about here is not only just a level of transparency, but also just managing expectations. Managing expectations is so important. Even if you don't have an update, but you tell them that I'm going to call you on this date and I'm going to give you an update. But if they call you on that date and they say, hey, I'm just calling you because I told you I was going to call you. There isn't any movement, but I wanted to let you know that there isn't any movement. Even that, despite it not moving ahead, is better than just leaving someone out there. And because what happens, I can just tell you this as a parent, is your mind starts to kind of percolate on things, and you start to kind of go into different tangents. You're like, well, they obviously don't care about us, so let's start looking for other solutions. And the fact that you've created something that gives this degree of transparency is fantastic, because not only are you getting the right match with the right, the right clinician at the right time, with, at the right point in time. I mean, it's all about that. So that's very, very exciting to hear this.
Yeah, I mean, I've been our own care advocate, where I've talked to families and I was like, okay, we need to set expectations. So we kind of built that in our tool. But I think the biggest thing in terms of transparency is, like, a lot of ABA companies expect you to just, like, if you say we have a team and we're ready to go, you're going to be like, who's coming to my house? Right? And
they just expect who are they? I want to know them.
And, like, what are their what's their experience? Why does it make sense? Whatever. And you kind of have to just pretty much blindly just accept and say, like, okay, sure. We did not subscribe to that nonsense. We will share resumes with everyone. Like, we populate that. The family gets to see who's coming into their home, agree and approve, and then we kind of move forward. And so I think that's the biggest thing, is like, I don't, it'd be great to just have blind trust from a family, but I think it's more important to just have buy-in. And so a lot of that stuff is, it seems small, but I think it makes a lot of difference for families to have insight into what's going on. And ultimately, the big part is having the right team in place that actually is equipped to help support their kids.
Well, you mentioned a buzzword there around advocacy. And what happens is initially when you kind of newly get minted into this world, when you are in this type of a circumstance, which is, it's a lifelong circumstance, you tend to not know things. And through experiences, you begin to realize that, hey, I need to advocate for my kiddo because
Yeah.
no one's going to advocate for them. And a lot of parents don't really understand that. They just feel like, all right, well, this is the only option that I have, and I'm just going to take it. I'm going to deal with it. And the reality is that we do have choice. There is choice there. So it's, again, it's nice that you can at least create a profile of someone and say, hey, here's why we selected such and such particular person, and based on what you've described, this is why we feel that this would be a good fit. Are you comfortable with that? And then obviously, again, managing expectations, getting agreement, and moving ahead on things. What have been some pleasant surprises that you've seen that that you just were just like, wow? I mean, it sounds like there've been quite a few, but are there any that really stick out into your mind?
I think we just, maybe just because it's fresh, we just sent out NPS surveys as well as ENPS surveys for our own employees. I'm blown away that anyone that works with us has given us a great rating. I think the one negative review that they weren't a promoter was we haven't been able to staff their family. And so they gave us a low score because they're like, we're still on the wait list. And that's fair, if we haven't actually followed through and matched them. But for the ones that we have put a team together, they've all just raved about us. And that's felt like, okay, it does speak to how our, whatever you want to call it, secret sauce, formula, algorithm, whatever we're doing is working, that the families really appreciate the teams that are working with them. They're not like, oh, we got staffed with some clowns or staffed with some, therapists that aren't qualified enough to support my kids. So that's been incredible, where I'm like, everything has been good.
Well, it sounds like what you guys are really focused on is around culture, is around the environment. And you had mentioned around sort of the training and delivering essentially information, care to your team members, which in essence are the ones that are caring for the families. Can obviously with everything that's been going on, is staffing continuing to be sort of an issue? What have been some of your biggest headaches, blockers, when it comes to kind of the next stages of growth?
So I think, our biggest blocker was staffing. Like, that's what took up the most amount of time. That's what felt like the greatest inefficiency. That is a industry-wide thing, but it was, killing us too. And, it hurts knowing that there's like potential families that could get care that are expecting, your support, and you're like, things could just slip through the cracks. So that's kind of been addressed now that we had our marketplace go live, a little over a month or two ago. And so that's been a huge monkey off our back in terms of feeling confident about that, and also receiving all the positive feedback on it. Now I think the kind of next step is at the end of the day, the biggest problem I'd say in healthcare right now is just the labor shortage or provider shortage of talented professionals. And so we struggle with that too, where, we just naturally have a lot of families on our wait list, and we need to find the right team members. And so I think, what we're trying to do, and our philosophy historically has been, we hire for experience, not potential. I don't think families should be the ones that deal with the downside of hiring for potential when it doesn't work out. And so I think one of the big things for us is, how can we create Teamwork University or Teamwork, Academy, whatever name we want to call it, by the end of the year, so that because we can see if match scores are not high enough, how can we provide the adequate amount of training in order to upskill them so that they are qualified to work with families that are waiting. And so we can increase the pool of actually appropriate and talented folks to serve the families. So that's one of our big bottlenecks. I would say the second thing is, now we're pulling all of our outcomes data because we collect a lot of data during every session. So from that, we can try to see how quickly are our clients like acquiring new skills? How are they doing? In order to see like, can we change our programs? Can we change how we're training our folks in order to just improve our outcomes more quickly? I think also the other big thing is maybe because I just care about expectations a lot. I'm like, if we can look at our data and say like problem behavior reduces by 30% in month one, by month 6, it's like 80%. I can set expectations for you being like, I just found out my kid was diagnosed. I don't know what to expect. And we'll be like, here's what you can expect on a population basis,
Yes, of course.
But I think that would be incredibly helpful. So families would be like, oh my God, this is possible. Or like, what is possible?
Not only that, I mean, but what kind of outcomes reporting are you doing to some of your payer partners?
Yeah, that's something else. I imagine we could be like, hey, we have great outcomes. Can we have a higher rate or something? Or even just help in like managing expectations. So like, insurance companies are always trying to pay for less hours of service. And if we can justify these are the goals and these are the outcomes, so that I'm like, hold on, give us more hours now and we will get the outcomes to reduce. But, just trust us for now. Here are outcomes. So a little pushback with insurance is it's great to have outcomes for that. So there's a lot of need for it, but I think the primary thing is if you can upskill our therapists and if you can make sure that there's quality throughout, so, our time with families, then, that'll be great.
And just sort of, just as we kind of close our time here, I mean, if there's just kind of looking ahead, things that you're most excited about, what's next? You as a CEO, you're obviously a visionary. What do you see next, for the organization?
I mean, if I'm thinking like just 1 year out or something, I'm thinking more like, take what we have. And I feel like, we've really ensured trains are running on time. Things are good. Like I'm excited by, especially when I just saw how really great our NPS survey responses were. I'm like, okay, we do have a good product in place. We're not like growing while still trying to figure things out. And like, no, this is a great service we're providing. I think initially it's probably just geographic growth, like we're right now in New York City, so serving the larger MSA and being in New Jersey and Connecticut as well. But I think longer term, what would make me feel like proud would probably be a family goes to teamwork and they're like, our kid was just diagnosed. Can you help us? We're like nonstop, yes. So we'll be like, we can support you and find a good team for ABA, mental health, counseling, OT, speech, whatever. We will help coordinate all of that. We will be affordable by being a network for all of those services. And then just by virtue of teamwork being a bit larger, we will give you that community so that you can talk to them. I mean, there are Facebook groups, there are different things, but I think it's quite different if you're like, oh, I can actually, I know this family member is like 3 blocks away or something. And both of you guys check a box to say disclose my info. I just want to be like, I just want that ability to say, we've got you covered for like everything.
Rudy, it sounds like you're building an incredible community, both internally, your team, the clients that you guys serve, and any last comments, thoughts, and what's one takeaway that you want to maybe share with some of the audience members if they're either thinking about starting an entity, or even some of the folks that are tuning in that are either on the innovation side, on the payer provider side? Is there one take that you would like to kind of leave them with?
I think it's just a little bit of like, just find a good partner. So Erica's my Erica's my co-founder. I cold called her. I found her name on a mommy blog, but I'm so lucky, you know, Ivy League PhD in applied behavior analysis. And I kind of was very lucky that she has such a high standard for herself where she's like, I can't have what we're building ruin my reputation. Like, we will only have really good clinical services and therapists, and we'll train them well. We're never going to put someone in front of a family that's not appropriate. And I think that largely, that's what helped us grow, is because I told you we did a shit job up until maybe 10 days ago of marketing or branding ourselves. We just grew through word of mouth. And so I think it's just, you find people that care about what, you know, what we're serving and providing to families, and you should do okay.
Well, look, I just want to commend you for the work that you've done, the work that you're about to do, and that you're going to continue to do. It's a cause that's very near and dear to me. How can people follow your work, follow you? Can you maybe share some of those? So we'll obviously link it in the description and stuff.
Yeah, I think, as I said, we're doing this whole, like, you know, raising visibility phase starting this month. I think we have like 50 followers on LinkedIn, so, you know, I'd like,
we'll definitely add more followers.
And then I think, you know, we're on Facebook. We just got our Twitter. We just got our Instagram. I think if you search Teamwork Healthcare, that's the way to go. And we do have a huge content management plan as well that is designed by what families are asking for, rather than like, how do I just get views or whatever, page rankings increases. And so I do feel like we have a lot of value to bring, but, you know, ultimately I just want to be connected with as many qualified and helpful therapists as we can, because that's what our families need.
There's two words that stuck out to me throughout this whole entire conversation, and it's quality and focus. And when you focus on quality and doing the best that you possibly can in every single circumstance, having high standards, never letting those standards get watered down, it's not shocking or surprising that you've seen a meteoric rise in terms of your growth. So congratulations on the success that you've had thus far. I think that the best is yet to come. So for those that are tuning in, you know, just grateful to have you on. And I just want to encourage you, wherever you are, wherever you're consuming this content, you know, hit subscribe right now. And would you mind even just sharing it, commenting on it on your social media? I'm just grateful when we have people that are coming in that want to make a difference within healthcare. And that, you know, we have a community of doers, as you're building a community of resources for these families, Rudy. We're trying to build a community of people that care about healthcare innovation, that want to lift society at large. And what better way to do it than through healthcare innovation? So appreciative of you carving out some time out of your hectic schedule, and looking forward to our next conversation.
I appreciate it.
Awesome.